If a doctor has told you your testosterone is low, or you've been thinking about starting testosterone yourself, give me the next 10 minutes before you do anything, because there's a mistake being made in clinics right now, and it cuts both ways. Some men are being put on a hormone they may not actually need. Others are being handed a prescription when the real reason they feel exhausted, foggy, and flat has nothing to do with testosterone at all. By the end of this video, you'll know exactly who this treatment is for, who it can quietly harm, and the simple 3-part test that tells them apart. Here's how this channel is different. No hype, no fear, and nothing to sell you. Just what the evidence actually shows, including the parts a clinic charging you for monthly injections would rather skip. Let's start with why testosterone is suddenly everywhere. Because it isn't only marketing. Researchers really have measured a steady drop in men's testosterone over the last few decades. One long-running study found average levels falling by roughly 1% a year since the late 1980s. And here's the part that surprised them. A 60-year-old man tested in the late 80s had higher testosterone, on average, than a 60-year-old tested years later, even after accounting for weight, smoking, and medication. It's not only older men either. A large national study found testosterone declining in men as young as 15 to 39 between 1999 and 2016. So the trend is real. Researchers point to things like rising body weight, less physical activity, and poorer sleep as part of the picture. But here's the trap. Levels are drifting down across a whole population is a completely different statement from, you personally need a prescription. That gap is exactly where men get into trouble, and it's where we're headed next. So, who is testosterone therapy actually for? Not whoever feels tired, not whoever turns 40. A real candidate has to clear 3 separate bars. And you need all 3. Not just one. Bar 1. Genuine symptoms of low testosterone. The most telling ones are sexual, a clear drop in sex drive, and erection problems. Others include deep fatigue, losing muscle even though you're training, gaining body fat around the middle, low mood, and trouble concentrating. But look closely at that second group, tired, foggy, low mood. That list describes 100 other things too. Poor sleep, chronic stress, depression, an underactive thyroid, simply being overweight. That's why symptoms on their own are never enough to justify treatment. Bar 2, blood work that actually confirms it, and this is where testing most often goes wrong. Testosterone has to be measured in the morning when it naturally peaks, and it has to come back low on 2 separate tests, not one. A single afternoon reading after one bad night's sleep can look low and mean nothing. The cutoff commonly used for low is around 300 nanograms per deciliter. Bar 3, and this is the one almost everyone skips. There has to be an actual medical reason your body isn't making enough. Doctors call that hypogonadism. Sometimes the testicles themselves aren't working from an injury, certain genetic conditions, or cancer treatment. Sometimes the signal from the brain that tells them to produce testosterone is disrupted. That underlying cause is what testosterone therapy is approved to treat. Clear all 3, and you're the person this treatment was designed for. Miss that 3rd bar, and you may be reaching for a hormone when the real problem is something else entirely. Which brings us straight to the men who should not start. Because for some men, testosterone isn't just unnecessary, it's the wrong move. Here's who needs to pause. If you want to have children anytime soon, this one matters a lot. Testosterone therapy can switch off your body's own production and lower your sperm count. It's often reversible, but it is not something you want to discover after the fact. If you already have a high red blood cell count, testosterone can push it higher and thicken your blood, and that raises clotting risk. If you've had blood clots or you have untreated severe sleep apnea, those need to be handled first. Active prostate cancer or breast cancer are reasons to hold off as well. And then the most common situation of all, when low testosterone is really a symptom of something reversible. Carrying extra weight, poorly controlled type 2 diabetes, and chronic sleep loss can all drag testosterone down. Treat those, and testosterone often climbs back on its own. No prescription needed. A careful doctor looks for that first. A clinic that profits from monthly injections often doesn't. That difference is the entire reason this channel exists. Stay with me, because next is the question everyone actually came here for. Does it even work? Here's where you need the honest version, not the ad version. The strongest evidence we have comes from a major set of trials in older men with genuinely low levels. And the results were mixed in a way that's actually useful to you. What testosterone reliably improved? Sexual function, desire, activity, and erections. It corrected certain kinds of anemia. And it raised bone density and bone strength, to a degree comparable with standard osteoporosis treatment. It also nudges body composition a little less fat, a little more muscle. There's even reasonable evidence that, paired with a real lifestyle program, it can help men at high risk of type 2 diabetes. Now, the part the marketing leaves out. In those same trials, testosterone did not boost energy. Sit with that for a second, because low energy is the #1 reason men go asking for it. And it did not improve memory or thinking at all. Mood lifted only slightly. So, if the hope is that a prescription will make you feel 10 years younger, sharper, and more energetic, the science simply doesn't promise that. It treats a specific deficiency. It is not an anti-aging shortcut. And honestly, that expectation is the whole difference between a satisfied patient and a disappointed one. There's one more thing you've almost certainly heard, that testosterone is hard on your heart. For about a decade, every testosterone product in this country carried a serious warning about heart attack and stroke. So, this is worth getting exactly right. That warning came from older, weaker studies. To settle the question, researchers ran the largest testosterone trial ever done, more than 5,000 men, all with low levels and all with either existing heart disease or a high risk for it. The finding: testosterone did not increase the rate of major cardiac events compared with a placebo. On the strength of that trial, in 2025, the FDA removed the long-standing heart warning from testosterone labels, but unbiased means I give you the caveats too. That same trial picked up a few unexpected signals, somewhat more irregular heartbeats, among others in the testosterone group. Regulators also added a new caution that testosterone can raise blood pressure. And the researchers themselves were blunt about one point: their reassuring result applies to men who genuinely have low testosterone. It is not a green light to hand the hormone to every aging man who asks for it, which is the exact line this whole video keeps circling back to. If you and your doctor decide you really are a candidate, a quick word on how it's actually taken. The most common method is injections, the most affordable and easy to stop if you ever need to. There are daily gels, though those carry a real risk of rubbing off onto a partner or a child through skin contact, so they have to be used carefully. And there are long-acting pellets placed under the skin, which are convenient but can't be adjusted or removed once they're in. Whatever the method, the single most important thing your doctor should track is that red blood cell count, a simple blood test, because that's the side effect most likely to need attention. So, here's the bottom line. Testosterone therapy is a genuine, well-studied treatment for the right person. And the right person has 3 things: real symptoms, low levels confirmed on 2 morning blood tests, and an actual medical reason his body isn't producing enough. For that man, it can change his life for the better. For everyone else, it's usually either unnecessary or aimed at the wrong problem altogether. So, the smartest question isn't, how do I get testosterone? It's, do I actually need it, and what else could this be? Ask that, get properly tested, and you're already ahead of most. I'm Dr. Naushian. If this helped you think more clearly about your own health, subscribe, because that's all we do here. The evidence, without the hype. I'll see you in the next one.